people that work in the healthcare field, they do a lot of work, whether we talking CNAs, LVNs, LPTs, RNs, they do a lot on the job. Those are 12-hour shifts, sometimes more, of constantly caring for other people and having to do it. And, like everything is not going to be perfect. So you gotta do it in unpredicting environments, for a lack of better words to say. So you got to get the job done in a unpredictable environment. So you got to be able to catch a good computer. You got to be able to. You probably have 5 or 6 patients. At any minute, anything could happen, like such as a rapid code, or somebody could like pass away on you. Somebody could be in very bad acute pain, and you gotta go do it. And you wish that you could go to the medication room and get like a morphine or a narcotic, but it's a lot of steps that people don't know that come into it. You got to get a witness. You also got to get some vital signs, because you can't. It's certain parameters that you can't give morphine or something with, because it could drop their oxygen levels and also their blood pressure. So you got to make sure that you got to get vital signs. You also got to get a witness, and you got to make sure that the order is the right patient and right dose and everything. But I say all of that to say that working in the healthcare field, caring for other people, it could be a lot mentally. And we get the job done. We get the job done, then I guess we clock out. But a lot of times we don't even have time to take a lunch. And if we do take a lunch, we come back and it's a bigger load, because that every 10 minutes or 15 minutes count in the healthcare field. But I say that to say, I realize on my off days that my patients are, a little shorter, because you can't care for, a lot of people, a lot of patients, and have a lot of baggage at home. And not even just at home, but like I realize that when I go everywhere I go with somebody, I give a lot. Like I donate a lot to kids, to older people, to the flower lady, to the fruit people. But I realize that my patients are a little more short, because I realize that you can give and give, and who's going to help you if you harm yourself or anything, right? So I've been going to like Walmart and places, and everywhere I go is like some kid asking for money, and usually I give a lot to them, like 20 to each. But I realize that my patients have been low, and I just want to ask, has anybody been feeling like this lately, man? Like, comment, share, and subscribe.